Hello YouTube family. Today I'm going to talk about some breakthrough in dry eye therapy. We are using what we call the platelet-rich plasma eye drop in dry eye treatment. This is something new that is really just developed in the past few years and become gaining some popularity because of the advantage of this treatment for chronic or acute dry eye. So first of all, I want to tell you is that the tear is a very special fluid in the eye. They compose of a lot of nutrients, a lot of proteins, vitamin, and also natural ingredient to help us to fight bacteria, and also they have ingredient to fight for inflammation. Say for example, anything get to the eye that the reason that you do not get red right away is because of tear. They do have some anti-inflammatory component to help you so you will not have redness to the eye all the time. So this platelet-rich plasma, what we call PRP, is basically draw from your own blood, and it's basically have several important components. They're using drawing your own blood, and then they're going to put some anticoagulant in there so that the platelet will not coagulate or stick together. And then after that they put into a centrifugal machine to spin the blood. The red blood cell and the white blood cell is going to settle to the bottom because they are heavier, and what left behind will be plasma and the black platelet into the fluid. And then they will draw the fluid out without the white blood cell and the red blood cell and put in the bottle as a eye drop. Now, the advantage of this is that when you're using this type of eye drop, this PRP eye drop, you have 2.5 to 8 times more platelets in the eye drop compared with your whole blood. And what is the platelet good for is that platelets have the natural healing power. They were able to again promote the healing cell growth, and also able to have collagen production, stimulate collagen production, able to heal the wound faster. Not only that, the plasma itself is also have rich in protein and also rich in the growth factor, rich in the anti-inflammatory protein in the plasma. So they're combining both anti-inflammatory, antimicrobial, as well as improve the healing factor. So by doing that, you're able to again do a lot of advantage towards the cornea and towards any of the red eye or infection. Now, how we can use the PRP is basically for people that have chronic red eye, chronic dry eye, meaning that recurring. It's just hard for you to use any kind of eye drop or artificial eye drop like steroid to suppress it. So PRP will able to again take care of the root problem, using your own your blood to heal that. And also people that have LASIK, dry eye related to LASIK, PRP eye drop also is a good alternative for that. And lastly, when you have a cut or corneal abrasion, a corneal cut, some paper cut, a fingernail cut to your cornea, and the PRP blood will also help you so they're able to heal as well as stop it from recurring. One of the major problems having a paper cut or any sharp cut to your cornea is that the healing is not good and they split open all the time. So using this PRP drop, you're able to again stop it from recurring, have a prettier healing, have a long-term comfort after you use the drop. And now again, how does the PRP prepare? Usually, the eye drop, you go to a pharmacy or go to a lab. They usually draw about 100 cc of blood from you, and then they will spin it, and then they will draw the PRP plasma from the tube, and then you will usually use 100 cc for about 3 months supply. And of course, you have to refrigerate them, and you have to handle them carefully so that they won't get contaminated. And normally, the price is between $400 to $600 a 3 month supply. And again, of course, if you have insurance, usually the insurance will cover it as one of the medication you use. And again, if you have any question regarding the PRP treatment to dry eyes, always call us, visit us, so that we were able to give you more information on that. Thank you for your attention. Have a good day.